disc bulge in the L4, L5 lumbar and S1 sacral region involves the lower spine, which bears the majority of the body's weight and provides significant mobility. When these discs bulge, they can compress the nearby spinal nerves, leading to various physical symptoms. Understanding the anatomy. L4, L5, the segment between the 4th and 5th lumbar vertebrae. This is a common site for issues because it facilitates most of our bending and twisting. S1, the first segment of the sacrum, base of the spine. The L5-S1 joint is where the spine meets the pelvis. Symptoms and clinical labeling. The symptoms generally depend on which nerve root is being compressed. This is often referred to as radiculopathy or sciatica. Symptom type. Common descriptions: pain, sharp shooting or burning pain that starts in the lower back and radiates down through the buttock and into the leg. Paresthesia, pins and needles or tingling sensations in the feet or toes. Muscle weakness, difficulty lifting the front of the foot, foot drop, or weakness when pushing off the ground with the toes. Numbness, loss of sensation along the outer side of the calf or the sole of the foot. Homeopathic management. In homeopathy, treatment is highly individualized. A practitioner selects a remedy based on the specific nature of the pain, what makes it better or worse, and the patient's overall constitution. Note: homeopathy is often used as a complementary approach. Severe neurological symptoms, like loss of bladder, bowel control, or sudden leg paralysis, require immediate surgical consultation. Common homeopathic remedies. Colosynthesis, often used for sharp neuralgic pain that feels better with firm pressure or folding the leg inward. Gnaphylium, specifically indicated when the pain is accompanied by a marked sense of numbness in the affected leg. Rhus toxicodendron, used for stiffness and pain that is worse during initial movement or cold weather, but feels better after continued gentle motion, the rusty hinge symptom. Hypericum, known as the arnica of the nerves, it is frequently used when there is intense shooting nerve pain resulting from compression or injury. Magnesia phosphorica, typically suggested for cramping pains that are relieved by heat and warmth. General management tips. 1. Core strengthening. Focus on physical therapy to strengthen the abdominal and back muscles, which take the pressure off the discs. 2. Posture correction. Avoid prolonged sitting or slumping. Use ergonomic chairs with lumbar support. 3. Controlled movement. Avoid heavy lifting or sudden twisting movements while the disc is acutely inflamed. If you are experiencing a pins and needles sensation, does it typically feel worse after you have been sitting for a long time, or when you first wake up in the morning?